Hello friends, welcome back to my channel. Today I am going to discuss with you regarding the role play. So ये रोल प्ले मैं आज बाई स्टैंडर्ड के ऊपर बनाने जा रही हूँ कि इस रोल प्ले में पेरेंट्स के साथ हमने एक नर्स ने कन्वर्सेशन करनी है. तो सेटिंग जो है डेट इज चिल्ड्रन हॉस्पिटल and background histories. You see the parents of 3 years old girl who has been brought to the emergency department because she has chest tightness, wheezing, and difficulty breathing. You are assessing her in tries and has just taken her vital sign. The child is not present for the discussion. So this is a background history. Now, how we give the introduction? Let me start. So this is a bystander task. So like this, good morning, my name is Raman Gill. I am one of the registered nurses working in this children hospital. So guys, please say, here we use nurses word. When we start with one of the nurses, how to ask the name of the bystander, like this. For our better conversation, how may I address you? Okay, so after introduction we can ask the name of the bystander or the patient, but in this case the case is bystander. Okay, so well, now I will tell you that from the background history we can assess that it is a known case or an unknown case. So friends, in this we have seen that the case is known as assessing her in the trials and just has taken her vital sign. Means the patient is that the child is already underwent with the vital signs. So it is a known case. How may I address you during for a better conversation? How may I address you? Then the bystander replies, Miss Rose. Okay, so then we start with, well, Miss Rose, thank you for allowing me to examine your child. ठीक, ओके, तो इसके बाद हमने उसको बोल देना कि थैंक यू. सो फॉर दिस, इन द टास्क 1 we can ask the question like this: find out. Now I'm moving toward the task. So find out more information about child symptoms. Okay, so use the bracket words efficiently, because don't skip any one of this. It is very important. And one more thing I have to tell you, that use 2-3 questions separately when the bracket more than 2-3 points are given. Okay, so don't use single question. Like here, find out more information about child symptoms. So here duration is also there, possible trigger, change in severity, treatment given, and previous occurrence. So we have to construct the question like this. First, we can ask before. Find out means we are asking or gathering the information from the bystander. So before moving further, may I ask you some question? We are taking the permission. Okay, and after taking the permission, when Miss Rose allow us, yes, then we can ask, okay, thank you. Then we can say how long she has the symptoms, that is a duration. So we can ask the question of duration is like this: how long she has the symptoms. उसके बाद possible trigger. So we can construct the question like, has any trigger, has she has any possible trigger before. Okay, and after that again, when Miss Rose reply yes back, and after that we can again construct the next question. I would like to ask you some more question like, any changes in the severity of your baby condition. Like then the Miss Rose will reply us that her child is having mild to moderate severity, and then again we can ask the question, has you given any treatment. Okay, then after that Miss Rose again reply us, yes, she has given nebulization. And the last point is previous occurrence. We can construct the question like, when the previously this symptoms occur. Okay, so Miss Rose will answer 1 month. And with this, first task is completed. Next is second task. Explore further relevant detail about child, like general health, recent illness, any medication, family history of asthma, hay fever, eczema, etc. So we can start like this. Miss Rose, I would like to ask you some more question. So we can ask like this. Have she has any medical condition and she is on any long term medication? Then Miss Rose reply, no. Then again we can ask the question. So have any family history of asthma or any hay fever and eczema is there? So again Miss Rose said no. So with this, our second task is completed. But before moving further task, third, we can say thank you for letting me know about the condition of your child. Then next is the third task, that is the examination part. Like this, give examination finding like condition stable, all vital signs normal, mild wheeze, no cause of concern. Outline next step, example, assessment by doctor, possible need for test, further investigation. Initial diagnosis, discuss about treatment, etc. So now we can start like this. Thanks for your answering. Based on the examination, your baby condition is stable and her vital signs are also normal. However, she has only mild wheezing. So here, यहाँ देखना पहले दो point that is positive side and another one is the negative side. We can use the contrast word like this. However, connector. Okay, so we can make construct the sentence like this. And next is overall there is nothing to concern or worried. Okay, we can use worried or concern. Concern synonym is worried. Next, and the next step in her doctor assessment and need to do some test and investigation. Based on her test, her doctor will make an initial diagnosis and discuss with you about her further treatment. So like this, our third task is also completed. Next, fourth task is resist. So in this, resist means saying no, but in OET speaking, we can't say no to the patient because OET speaking is very polite. Okay, so we can use the phrase like this. I'm not the right person to tell you about the diagnosis of your daughter. Symptoms are consist of with but her symptom consists with asthma. The doctor is the right person to make diagnosis. Moreover, asthma is difficult to diagnose at the young age and early age. So, like this, we can tell the bystander. And the last point is find out any other questions and concerns. So, we can construct like this statement. Do you have any other concern to be addressed? Okay, will tell us yet he has concern regarding how long she has to wait for the doctor. So we can reassure the patient to get their answer. Okay, so we can start. I assure you that your doctor will come shortly. He is not busy at this time and there are number of doctors available. So they will be seeing your daughter very soon, and then the quick examination will be done by your doctor, and then the doctor will enable with salbutamol inhaler. So we can also check that relative or the bystander understand what the nurse explained. So we can ask, is that all right? Okay, then at the last, establish patient consent to return to waiting room. So this is the concern of the bystander. So we can say At last, I hope I have cleared all your doubt. If you don't have any question, Miss Rose, please wait in the waiting room and I will call your doctor very shortly. And thank you once again.